New Providence now leads the nation with a growing number of COVID-19 cases. Good morning, everyone. I'm LaDawn Davis, and this is the Morning Edition. Thank you so much for tuning in. Health officials continue to see more COVID-19 cases, with 36 of them recorded on Wednesday. 30 of them right here in the capital, pushing the overall numbers to 342. This is followed by the nation's second city, Grand Bahama, which saw 6 new cases for a total of 336. The nation's COVID-19 cases now stand at 751. Health officials continue to sound the alarm for residents across the Bahamas to help stop the spread of the virus. This morning, Deputy Chief Medical Officer Dr. DeLon Brennan spoke to those numbers.
Seeing a decline in the numbers of new cases that are showing up in Grand Bahama, which is encouraging. We will get an opportunity to do some further data analysis over the next day and a half, and ideally we'll be able to present that to the Bahamian public. And if we really have seen enough of a trend that it could be encouraging, then our recommendations will then be based on those findings. But we do need to make sure that things remain in place, and then we'd be able to make a more thorough recommendation based on the things that were recommended for Grand Bahama, their approach, and whether they should continue with the rest of the Bahamas on its path, or would they be able to open up, with less restrictive measures starting even before the rest of the Bahamas does.
And transitioning to the nationwide lockdown, the new schedule that's August 4th to the 19th, making provisions for shopping, access to health services, banking, medical care, and limited outdoor exercise movement, all requiring some degree of exposure to the public. Now, with the obvious need for the public to continue with life, is the COVID-19 task force satisfied that these measures are sufficient?
I think we have to, given that there has to be a balance, and we're not going to achieve the ability to just keep everyone inside and away from each other forever. I think this is an attempt to break the chain of transmission, minimize people's exposure to each other, and get a better handle on this. So for now, we think these measures are smart to take, and we would like to see if they are going to arrest the current trends that were going on. It's going to take some viewing and analysis of that to be able to make it and say, is it enough? Is it too much? Is it not? That's going to take a moment. But for right now, we're satisfied that it is a step in the right direction to get us where we need to go.
And with New Providence and Grand Bahama leading in the new cases here in the country, have officials observed any connection between patients that would suggest a kind of community spread or clusters?
For right now, we are still seeing a significant amount of cluster transmission, so around cases and their contacts. We get very few just community-based spontaneous cases that would suggest widespread community transmission. But with our numbers, we do have to be concerned about that. So it is still something that's in the front of our minds. But for right now, most of it is still related to known cases and their contacts.
A few weeks ago, when restrictions were lifted and persons were allowed to travel, there was a boat that would travel out of Grand Bahama into the United States, travel back. And then some of those persons are believed to have traveled to other places here in the country. Was that something that health officials was monitoring?
We did. We have been able to sort of track our chains of transmission to a number of cases of travel. So the initial cases were definitely within persons who traveled, then ended up spreading to persons within their community, their families, their workspaces, and now, those people who had never left but were infected by those persons are now infecting others as well. So it's showing in our chains of transmission that it started with travel, but it is not only people who travel.